Thank you, Dr. Miriam, for her excellent talk and also for her continuous support for countries in Africa, especially her origin country, Egypt. Thank you.
I add my voice to my dear friend Hani, and also we cannot forget your efforts in Africa in collection of the Imagine database. It was huge work, Miriam, and thank you very much for all your initiatives you have mentioned. And now I'm going to another division, and you know have guests before, but now we have our eminent Professor VESNA GERSHAN. She's the professor of medical physics, and she represents the Nuclear Safety and Security Division of the IAEA and has over 20 years of experience in medical physics and radiation protection of patients. She is really dedicated and supports optimization in Europe, and we would like to hear from you, Professor VESNA.
Thank you, Dina. Thank you so much. And my special thanks goes to all of you who decided to stay in the room instead to go outside and enjoy the nice view and so on. As a professional in this field, I would say that there are many, many challenges, but which one to select and to present in a very limited time. I chose 5 of them, and I did the right job. How I know that? Because all of them have been previously mentioned. That means that are the most common type of challenges that we faced. So it was said that there is a trend in global annual number of medical radiological examination procedures is increasing decade by decade. If we focus on in the latest decade, annually averaged 4.1 billion procedures have been performed in diagnostic radiology, 23 millions in interventional radiology, 40 millions in nuclear medicine, and 6.2 in radiotherapy. In other words, that means officially estimated, in reality, higher number, more than 11 million medical exposures are performed daily around the world. So what does it mean? That medical exposure actually is by far the largest human-made source of radiation exposure of the population. And it's not a matter only of radiation protection, of radiation risk. As we see yesterday and today, from many aspects, this creates a lot of problems. As challenges number 1 is justification. Obviously, many unnecessary imaging procedures are performed. And some estimations say that between 20 and 50% in some areas are not justified. There are many difficulties, complex issues, many factors, many stakeholders involved, many barriers, lack of awareness, for example. And the simplest solutions or advice is AAA: increase awareness, improve the appropriateness of the practice, and conduct clinical audit on a regular basis. The IAEA continuously works, as my colleagues present very well the part of our work, to improve the level of justification through different organizing events, technical meetings, consultancy, workshop, training course, whatever it is. So I would just mention that our next big ARFRA regional meeting on justification of medical exposure will take place in June 2023, this year, in South Africa. All these efforts were conducted together with eminent international organizations. The second big challenge is optimization. What does it mean? That the most, particularly in the developing country, of the procedures are performed on the way that they give higher dose that is necessary and contributing to the radiation risk to the patient. What are the reasons? Lack of knowledge and skills, lack of qualified medical physicists, not having diagnostic reference level, as Professor Donald Prof discussed, lack of operational procedures, protocols, established good quality assurance and quality control programs, etc. Challenge number 3, recurrent imaging. Particularly big challenge in developed country. Africa maybe is not, but in developing country, this challenge becoming day by day more challenging and create a lot of burden from radiation protection perspective. So there are many articles that says that if you apply conservative approach, estimation at global level that between 800,000 to 2 million patients getting added higher doses than 100 millisievert per year. That practically means 1 out of 125 patients in computed tomography receive doses higher than 50 millisievert from a single CT exam. In 5 years, the number might be doubled. So IEA put a lot of work to address this issue, organizing different technical meetings for justification, optimization, and the latest one was organized in February, and Professor Donald Prof talked about this. So what should be done in this? To assess the level of recurrent radiological imaging most accurately, to identify clinical condition where recurrent radiological imaging is likely to lead to the higher dose to the patient, to develop strategy, to ensure that justification and appropriateness criteria are implemented into clinical practice, to establish dose monitoring for the patient, to apply all possible tools, methods you have, to decrease the patient dose, to strengthen radiation protection education and training and communication. Challenge number 4, competence of health professionals. There is no any other area, specialty in medicine with such a rapid development as it is imaging modalities technologies. That is a good news. We are privileged working in this field. But the bad news is that very often academic education curricula and clinical training programs can barely cope with the latest technology. So this imposes real challenges for the health professionals to keep up their competencies on the right track. Challenges number 5, building radiation safety culture in medicine. This was one of our favorite projects, and we developed a handbook, training materials, organized a lot of events, because it can help a lot in the lack of not having image reference guidelines, appropriate criteria of appropriateness, dose monitoring since patient dose systems, etc., etc. I do believe that taking individual responsibility, taking leadership responsibility, and continuous learning, very sorry, are those real actions, not tools only, and those can make people to do right things, and those can considerably contribute in facing the radiation protection challenges in the new era of radiation protection in medical imaging. Thank you so much.
Dear Professor VESNA, thank you very much for the